when we're talking of content, like we mentioned, whether you're a orthopedic, whether you're an ENT, whether you are a physiotherapist, whether you are a homeopath, whether you are a cardiologist, whether you're a respiratory specialist, whether you're starting a new clinic altogether, you've just graduated, you're part of the digital community, you were always active on Instagram even while you were in college because that's the new generation, right? Or you are a 45-year-old, 50-year-old who's been into practice, and now the younger generation also wants to come and they want to start with a digital presence for the clinic as a whole, as a brand. Sometimes you are, you've recently got married and you've shifted cities. Like we've had instance of someone going to Bangalore and then starting all the way from scratch from there, finding it very difficult, and you want to make yourself known there. Or you got married into a doctor family that was already present in somewhere, like Indore or Ranchi, we've had cases. And they already were set there, but now you want to add your name to it, right? That there were two doctors and now you are also part. Of course, the board changes. So content, when you are creating, you have these as a take-home message. Remember, content is not just what goes on your website. Of course, it's your website. It's also your Google page. It's also your Facebook page. It's also your Instagram bio. If you are on Twitter, it's also LinkedIn at times. Don't forget that. It's also what you put as part of your WhatsApp business. Many doctors have now realized it's better to be on WhatsApp business, if nothing, just for that quick away message. Content is also what your receptionist greets your patients with. It's also the disclaimers that you put out in the clinic. There's a whole lot of content that goes out there. The services that you offer, you've got a new machine in your clinic and you want to talk about it. How are you going to put it across to the patient in a layman language such that they understand the importance and beauty of that machine? How are you going to keep it concise such that they can forward it to someone who might need that particular service or machine, right? You've done a new course on hypnotherapy. You want to talk of that and at the same time raise awareness about that. Nutrition is a whole different field altogether. So content is part of all of this. It helps to have some guidance, and this is not self-marketing, but this is what we've done, and we know others also who do this. HomeoMitra has been a great mitra to a lot of people in advising them to not, kind of stay focused. So it's okay. Everyone does not know everything. I myself don't know a lot of things. I went to learn coding. I went to do MBA, but everyone, you can't be there, right? So I also have my digital marketing experts whom I refer to. I also have my social media experts whom we deal with. I have my SEO team who kind of, analyzes and gives us the best algorithm, what is required. And of course, we have editors who kind of take care of the English and AI tools and whatnot. So it's okay to take a very structured approach. Be very sure who your target audience is. Be very sure why you're putting it out there. Have a focused strategy. Budget it well over a long period. Don't just do a blitzkrieg like a 1 month blast and you're gone from social media. Don't do that. Doesn't work. So focus little but often, be consistent, and at the risk of sounding philosophical again, be true to yourself. Be ethical in what you do. It pays in the long run. It pays significantly better in the long run. Don't be very myopic in your vision for growth. Being a doctor is a lifelong journey. You're going to see patients forever and ever, and most of us hope to not retire and keep working. So it's the brand of yourself that you're building from day one. Whatever the breaks in between, whether you go for higher studies, whether you have a maternity leave of sorts, whether a pandemic hits, whether you have migration, you continue being a doctor wherever you are. And thanks to the digital world now, we can continue practicing from across the world, like we are connecting today, rather than sitting in a seminar hall and discussing this and taking open questions. So this is great. And I think this is the message. Be focused. Content is something serious. You can be a part of it. You can approach someone to take some advice on it, but keep it structured, keep it consistent, and please, please, please keep it ethical. It will help us all.